Good afternoon, Dr. Castleman. My name is Lawrence Nassif from the firm of Seeger Weiss. We definitely appreciate you giving us time to speak to our audience in Spain today. And if you could give a little bit of your background to the audience, we'd appreciate that.
Sure. I was originally trained as a chemical engineer and went to work for the chemical industry, decided I didn't want to spend my life making pollution in consumer commodities, and went into training in air pollution control after that. And this was 1970, 1971. And this was just at the time that the U.S. government was creating the Environmental Protection Agency and the Occupational Safety and Health Administration. So there were fellowships available for people to get education in the field of such things as air pollution control. While I was in school, I was just an engineer, didn't know anything about public health. I decided I wanted to learn more about the health effects of air pollutants. And then I came across asbestos and I was quite amazed. There had been a major medical conference on asbestos published in 1965. 800 pages of articles about how lethal this stuff was, about how there were mesotheliomas not only in the workers but among the family members of the workers, among the neighbors of the asbestos factories who had never worked in the factories. And so this meant that the population at risk, as we say in public health, included millions of people. It wasn't limited to a few thousand heavily exposed workers in asbestos products plants or anything like that. It was all these construction workers and all of their family members and all the people who lived and worked around them. And in addition to that, there were consumer products being sold in the United States in hardware stores, as we call them, where people would do home repairs, and you could buy a sack of asbestos. In 1973, when I was asked to testify at a congressional hearing, I brought with me a 5-pound bag of asbestos. It was a paper bag with nothing but asbestos in it, marked only with the price. There was nothing else on the bag about the dangers of this stuff. And that's what was going on in this country in 1973, which was the year of peak U.S. consumption of asbestos. The U.S. consumption is now down to about 1,000th of what it was in 1973. Just a very little bit still is used here. So that's how I got interested in asbestos. I soon started working with non-governmental organizations as well as working as a public health official in the early 1970s. I inspected the local brewery. I found them using asbestos filters. I got them to stop. I inspected the local distillery. I found them using asbestos filters, and we verified the contamination of the liquor they were making by electron microscopy in state laboratories. And we got them to stop using asbestos. And so, but it was used for all kinds of things, and there was almost no control at all. And so this is the way it was when I came on the scene. I soon found myself working with this outstanding, famous epidemiologist named Dr. Irving Selikoff in New York, who had organized that big conference in 1964 that was the subject of the volume of proceedings that I was just talking about. And we would eventually work together on such things as getting asbestos banned in the filtration of intravenous drugs, because it contaminated the drugs like penicillin, and getting asbestos banned in joint compounds. These were commonly used in indoor construction, in offices, homes, and buildings. And also Dr. Selikoff's people assisted me in sending out warnings to automobile dealerships to warn that the brake mechanics were in danger of asbestos-related cancers by using compressed air hoses to blow out the brake housings and things like that. So I started working, trying to use these governmental regulatory agencies in the United States to deal with specific problems, specific products, and get them regulated or banned. At the same time, there were generalized efforts to regulate worker exposure and environmental exposure through regulations on air pollution and occupational asbestos exposure.
Interesting. Doctor, when would you say that the scientific community began to realize that there were some dangers with the use of asbestos and the use of asbestos by certain workers?
Well, the recognition of the hazards of asbestos goes back 100 years. The first reports that were published were government reports in England, where the chief inspector of factories in his annual report noted that there were people with lung conditions who worked in environments where asbestos was used. And the words that the evil effects of asbestos were used in this 1898 report. By 1918, an insurance official, Frederick Hoffman, writing a monograph for the federal government in the United States on mortality in dusty trades, wrote that it was generally the practice of the life insurance companies to not sell life insurance to asbestos workers on account of the dangers in their trade. And he had some statistics indicating that these people were dying before their time. They were dying from such conditions, according to the records, such conditions as pneumonia and tuberculosis. But to the life insurance companies, it didn't matter what was written on the death certificates. They had already identified asbestos workers as bad risks for life insurance, and this is before the word asbestosis appeared in any medical journal, which happened in the 1920s. So there started to be these reported cases of asbestosis, and the disease was described in the 1920s in considerable detail. People were dying from asbestosis in their early 30s from having worked in asbestos factories, and pathologists described the abnormalities of the tissues of the lungs as seen under the microscope. The clinicians described the clinical appearance of people with this disease, the decreased chest expansion when they took in a breath, the shortness of breath upon exertion. These were the principal signs. So at first you would have trouble running to catch a bus, and then when the condition became worse, you couldn't even talk like I'm talking now without having to stop and catch your breath. And so this would be a gradual thing that came over a period of years. Then the British government finally did a survey of people in this industry and published it in 1930. Dr. Merriweather was the principal author of this, and he found that 1/4 of the people in the industry making asbestos products, and they examined over 300 workers, 1/4 of them had this disease, asbestosis. These are people who were actually getting up and going to work each day. Dr. Merriweather found that none of the people with asbestosis had worked less than 5 years in the industry, and so he inferred from this that there was a maturation period, as he called it, for the creation of this disease, that no matter how dusty your environment was, you weren't going to get sick that week or that month or that year. It would take longer than that before the asbestos mineral fibers would interact with your lung tissues to cause actual lung damage that you would start to feel in your breathing and in your life. And then other cases were published in the early 1930s, people with exposures as short as 6 months, later developing asbestosis, or people who were only office workers in asbestos factories. They never worked on the production floor. Cases were reported in the mid-1930s in England and in the United States. Cases of people using asbestos products, insulation workers primarily. And this meant that the population at risk was vastly enlarged because there were only a few thousand people working in the industry of making the asbestos products, but there were millions of people working as construction workers who were exposed to the dust from insulation. And so this was already apparent in case reports in the 1930s. And insurance companies were also very leery of insuring anything having to do with asbestos, and this appears in their journals in the 1930s, where they had different rates that they charged for things like workers' compensation and group life insurance and so on, and they had extra charges for hazardous industries. And so this is another way in which this knowledge was available. So governments started to make asbestosis a compensable disease. The earliest case I know of was in the United States in 1927 in Massachusetts, and then nationally in Britain, 1931, asbestosis was added to the list of compensable occupational diseases, and then Germany and other countries followed in the 1930s in recognizing that this was an occupational disease. Then in the mid-1930s, there started to be reports of cancer of the lung in people who were dying with asbestosis. These cases were first published in England and in the United States, and lung cancer was a lot less common then than it has since become, and so it was striking to these doctors. And they said maybe asbestos causes cancer as well as this lung scarring disease, asbestosis. By 1938, a German author appeared, Nordmann. He was sure asbestos caused cancer. He titled his paper, "The Occupational Cancer of Asbestos Workers." And he added his 2 cases to the 4 cases that he was aware of in previous writings in the U.S. and Britain. Said there's a common, these are the reasons this is an occupational cancer. He said, number 1, in Germany and in England, of the people who have died with asbestosis, 1 out of 6 had cancer of the lung, 17%. That's 10 times the normal rate of lung cancer in general autopsies. And this would be a consistent finding in all subsequent reports, that among people dying with asbestosis, there was much, much too much lung cancer. And Nordmann also noted that there was a common time period of 15 to 21 years from the onset of exposure until the time these people died. So the people who started at an early age died at an early age, much younger than people usually had died with lung cancer. And the people who started working with asbestos older, they died older. But there was that consistency in all of the cases. And so Germany made lung cancer a compensable disease among asbestos workers and started to compensate people officially in 1939. Let's close that window. We've got a little noise.
Yeah.
There would be other reports. Dr. Wilhelm Huper in the United States published a book on occupational cancer in 1942, said very likely asbestos causes cancer of the lung, citing mainly American, British, and German reports which were continuing to accumulate. Czechoslovakia would make lung cancer a compensable disease in 1948. And so this was widely accepted. It was the subject of an editorial in the Journal of the American Medical Association when the British government published statistics on this. By 1947, the government was aware of 235 deaths in which asbestosis had contributed, and 13% of these people had cancers of the lung and pleura, and that was more than 10 times the rate of such cancers in the general autopsies in the general population. So this was very, very powerful evidence, very statistically powerful evidence that people who worked with asbestos had an occupational cancer risk, which was then described by the British government as cancers of the lung and pleura. They were including the mesotheliomas with the lung cancers at first, right. Not paying special attention to them. As to mesothelioma, it was the German pathologists who first identified this as a distinctive disease caused by asbestos, and that was in a report published in the German Medical Weekly in 1943. So this knowledge goes way, way back. And so by 1965, as I've said, it was documented that there was a terrible excess of cancers of the lung and asbestosis among people who worked with asbestos, also mesotheliomas, and in addition, because the mesotheliomas were so identifiably caused by asbestos, it was possible to see that this hazard was getting out into the community in the form of household contact cases and neighborhood cases.
Doctor, can you tell us right now what are the stance of the U.S. governmental agencies in regards to asbestos? For example, the EPA and or NIOSH. What are their stance on asbestos?
Well, their position is that there's no safe level of exposure to asbestos. The EPA tried to ban asbestos in all of its major applications in regulations published in 1989. These regulations were challenged by the asbestos industry and overturned in the courts in 1991. So officially, there is no ban. But because of the enormous apprehensions workers have about working with asbestos, because of the difficulty of selling products containing asbestos, because of the liabilities associated, more than anything else, liabilities associated with asbestos, that's what's really shut the asbestos industry down in the United States. It's the American system of product liability which has really been decisive. Not government regulation as in Europe, but the liability of selling products that contain asbestos and the many, many billions of dollars of liability that have already been incurred by companies for selling such products, which got industry to be very serious about replacing asbestos in the United States.
And what is the position on the World Health Organization's position on asbestos? Have they been involved in that? Have they given an opinion on the dangers of asbestos?
Yes, the World Health Organization in 2006 called for a global ban on asbestos. So the World Health Organization said, look, there's no safe level of exposure. This stuff is used in construction materials, which is going to expose large numbers of workers, is extremely difficult to control in terms of industrial hygiene, and this stuff should just be banned everywhere. And so now the World Health Organization, and I'm a consultant to the World Health Organization working with them in Europe. I just got back a couple days ago, and they're trying to do outreach to the former Soviet countries. So we're talking about countries like Belarus and the Ukraine and Kyrgyzstan, and the World Health Organization is trying to get these countries to follow the agreement of their ministers to develop a national plan on asbestos by the year 2015, and hopefully to phase out any continued use of asbestos by that time or soon afterward.
I understand you're involved in a case in Italy. Can you tell us a little bit about that?
And so in this case that I'm involved in, the prosecutors went beyond just looking at plant managers, and they went to the big bosses. And the defendants in this case are the owners of the Eternit asbestos enterprise from Switzerland and Belgium. One of them is named Stefan Schmidheiny. And Mr. Schmidheiny is 65 years old. He is the sixth wealthiest man in Switzerland. According to Forbes, he's worth $2.8 billion. And Schmidheiny, at the age of 29, became the chief executive of this Eternit enterprise. And they continue to operate, making asbestos cement products for the next 10 years or more. And there have been, and the charges in the case are that in the course of doing this, in Italy, where they had 4 factories, and in Switzerland, where they also employed some Italians who came home and died from asbestos disease, the charges that the company created an environmental disaster causing several thousand deaths. And at the end of the case, the prosecutors said, we believe that we want to increase the charges and ask for 20 years imprisonment of the two defendants, not just 12 years, based on the evidence that came out in the case. My role in the case was to provide an international perspective and show how the Eternit companies were in contact and in communication with other companies in England and the United States and elsewhere where the asbestos industry was coming under fire and dealing with bad publicity back in the 1960s and the early 70s. And there were some documents relevant to the knowledge of the Eternit companies going back to 1950, showing that the Schmidt-Heine family was aware of asbestosis in their correspondence with their subsidiary in the Netherlands. So these were some of the things that, and they were also blocking the British from putting warning labels on products. They were telling the British to not send products with warning labels onto the continent. This was recorded in 1978 in a minutes of the Asbestos International Association. See, what happened was, starting with Britain in the 1960s, they developed more modern standards to protect workers from asbestos and published those in 1969. They were getting a lot of bad publicity. Some of the research was done in Britain, and it was showing up in the newspapers about the household contact cases and the neighborhood mesothelioma cases. And there were dockers who were refusing to handle cargoes of asbestos. Sacks of asbestos were coming in jute bags that leaked profusely, and the dockers didn't want to handle these things. And so there were strikes in 1967. There were strikes over the use of asbestos insulation by oil workers at refineries at Shell in 1967 in Scotland. And so because of this kind of public pressure and bad publicity, the British industry was a leader in developing a public relations response to this challenge, and they had offices with public publicists called Hill and Knowlton, who had developed their expertise working for the tobacco industry before, and so in the 1960s they started doing work with the British asbestos companies. The British were then basically hosting the other asbestos companies in 1971 from all over Europe, saying, you need to start to develop these kinds of public relations units in each country. And so by 1969 there was only one such group in England. By 1971, according to the meeting, there were 11 countries that had asbestos public relations offices, including the United States, where it was called the Asbestos Information Association. And it was all for public relations, for lobbying the government on regulations, for sharing information among the members of the industry so that they would have, all of them, a consistent line of argument for anything they were asked, and also for dealing with the media. And so this was important, and it was, the trouble started in England, America, and the Netherlands, where the unions were raising hell, and they were bringing in government inspectors, and the insurance companies were starting to raise their rates. And so all of these pressures are depicted in this 1971 conference that was held in England. And there you can see there was this need for the industry to develop across national borders an international defense on this, because up until this time they had never really been under very much pressure. Right. They'd been basically getting away with not telling people how dangerous asbestos was and not being challenged on it.
Is there an organization that is on the other side of that organization that you're involved in? Well,
not until many years later. Just to complete the story about the asbestos industry, they created something called the Asbestos International Association in 1975, and it was their minutes on warning labels that I was referring to when I said that the Eternit guy was telling the British not to use any warnings on the products that they sent to Europe. In terms of international activists, there have been meetings going way back. I remember going to a meeting in Spain and meeting a unionist named Francisco Baez Baquet, B-A-Q-U-E-T, and he was from Seville. And I remember him telling me, we have to document cases of asbestos disease in Spain before we can do anything about the problem. And I remember saying, you must be crazy. The medical literature's full of cases of asbestos disease under all these circumstances. What makes you think that people in Spain are any different? He said, it's not that the people are different, it's just that politically, before we can do anything about this in Spain, we have to make it visible. We have to identify cases. And that has proved to be true everywhere in the world. And so, working with people in other countries, starting in 1993 or so in Europe, there were meetings by activists who were starting to talk about how we need to get bans on asbestos. In more and more countries, we need to share information with each other. And in 1999, the International Ban Asbestos Secretariat was set up in London. And that still exists. They have a website. They do wonderful work. There have been bans on asbestos in more and more countries. And the wonderful activists from Japan and Korea, where asbestos is now banned, are very actively working with people in the other Asian countries to try and raise their awareness and help them to develop regulations, help them to diagnose cases of asbestos disease, get people compensated who are disabled with asbestos disease, all of these things. And so there's a very active international effort, both by the non-governmental organizations I've just talked about, as well as the World Health Organization, the International Labor Organization, and in the Americas, the Pan American Health Organization. I'm working on something called the Asbestos Atlas for the Pan American Health Organization, which was paid for by the Spanish government. The Spanish government came up with a $40,000 grant to do this, and I haven't gotten paid anything, but I spent it all on expenses, and we've gotten country reports from about half of the 36 countries in North America, South America, and the Caribbean, Central America. And those are the countries in the Pan American Health Organization.
So, Doctor, based on your history working in this field, do you believe lawyers such as the ones watching this tape right now can make a difference in terms of advancing worker safety, in terms of asbestos and industrial practice?
Sure. In so many cases, I see, the doctors can't do much for these people. They're dying from asbestos, but the lawyers can at least get some compensation so they have some financial comfort in their old age, or something they can leave to their families so that their families won't be destitute. In the larger social picture, I see prevention as being largely based on compensation. Wherever there's compensation, the asbestos industry is gone. In countries where we're trying to get the upper hand in dealing with asbestos, getting people who are disabled from asbestos disease or dying from asbestos disease, getting them compensated is an essential part of the bringing about the prevention that we want, and ultimately banning the use of any more use of asbestos in a country. So yes, I mean, I think I've learned to have a great deal of respect for attorneys. I've worked with lawyers now. I've been testifying in this litigation as an expert witness for more than half my life. I started doing this in 1979. And I consider that the lawyers and the legal system that we have in the U.S., where there is such a thing as product liability, where if you're selling a product to the public that has lethal dangers that are not obvious, that you are held to the standard of an expert about the hazards of your product, and you have a duty to warn people based on that about the hazards of your product. And this is tremendously important in public health protection in the United States. And so I think this is a tremendously important thing in terms of public health. It's not well understood, even in the United States, that we have this kind of protection that is afforded by the existence of laws on product liability. But it's a real important thing, and Europe should have it too. I mean, there's no reason the asbestos companies in Europe should have been allowed to get away with selling products that they knew were killing people without putting warning labels on the products about the cancer hazard. And you know, you can generalize from there to all kinds of products that have non-obvious, very often delayed lethal dangers, like asbestos.
Are there any studies out there that discuss, or do you know how many deaths asbestos is responsible for on a worldwide basis? Are there any statistics out there?
The World Health Organization estimates that 107,000 people die each year worldwide from asbestos-related disease. And that's occupational exposure. Then you can add thousands more from environmental and household contact exposure. You know, so that's at least generally. I mean, nobody has an exact figure, but that gives you some idea. In this country, the United States, we have about 10,000 deaths a year from asbestos-related disease. The thing that's most reliable in most countries, like Spain probably, is the mesothelioma incidence. And from that you can estimate, well, for every mesothelioma caused by asbestos, there probably are 2 more lung cancers that are caused by asbestos, based on the epidemiology of workers who were exposed to asbestos, that most of whom die of more of whom die from lung cancer than mesothelioma. So it's from things like that we're able to make these estimates, basically starting with the mesothelioma figures and extrapolating from there.
Right.